Hi, my name is Mahale. Today I'll be doing a video how to draw insulin. First thing first, I'm gonna go ahead and verify my orders with the healthcare provider and verify the six rights of medication: right patient, right dose, right route, right time, right documentation, and what did I forget? So right patient, right drug, right dose, right time, right documentation. Six. We're gonna verify that, and after that I'm going to check my medication to order in the EHR and the electronic health record. After that I'm going to go ahead and introduce myself. Hi, my name is Mahalet and I'll be your nurse today. Is that okay? And yes, I'm going to go ahead and start. I'm going to provide privacy and I'm going to identify my patient using two patient identifiers. So I'm going to ask my patient's name and date of birth while I'm checking the wristband. That would be my two identifiers. And I'm going to ask if my patient has any food or medication or seasonal allergies. And I'm going to perform hand hygiene and apply my clean gloves. And I'm going to tell my patient the purpose of my visit. So I'm gonna be talking about the medication that I will be given, which is insulin. I'll tell my patient that its insulin is used for to control the blood sugar. It's used to take place of the insulin that is normally produced by the body. It works by helping move sugar from the blood into other body tissues where it's used for like energy. It also stops the liver from producing more sugars, and common side effects can be redness, swelling, itching, change of the feel of your skin, the skin thickening, buildup of fatty issues, and a little depression in the skin, fat breakdown. And the redness, swelling, itching is at the injection site. Weight gain, constipations are the common side effects for the medication, and some side effects can be serious, like adverse effects can be rash or itching over the whole body, shortness of breath, wheezing, dizziness, and having difficulty breathing or swallowing, weakness, and muscle cramps and extra are the adverse effects. And I'll give time if my patient has any questions. If not, after I explain, I'll give my patient time to ask any questions. And if my patient doesn't have any question, I'm gonna go ahead and wear my clean gloves. After I apply my gloves, I'm gonna explain to my patient that they might feel a slight burning or stinging sensation while administering the injection, and I'll tell the patient to report if there is any adverse effects or any side effects that I mentioned earlier, to let us know if any of that symptoms experienced. And before I administer this, I'm gonna go check my my patient's blood glucose, and also check the time when they're gonna have the meal, because they need to eat after getting these medications within 15 minutes. So now I'm gonna go ahead and show you how I'm going to draw. Let me just fix. Okay, I have my alcohol swab and I have my needle here. And first thing, what I'm going to do is I'm gonna roll the vials, put it in my middle hands, roll them, and make sure they're mixed thoroughly. I'm just gonna like pick it up and put it in between my hands and roll until they're thoroughly mixed. Do not shake it. And then what I'm gonna do next is I'm gonna get my alcohol swab, And I'm gonna wipe off the top both insulin vials for a good 5 seconds. Trash that. And then now with this still on, I'm gonna go ahead and draw air with the syringe. So the orders I was given is 4 units regular and 8 units NPH, and total is gonna be 12 units of insulin that I will be administering to my patient. Let me move it a little bit. So I'm gonna start injecting air. So for this order, I was giving 8 units. So I'm gonna go ahead with this still on. I'm gonna go ahead and draw 8 units. I don't know if you're able to see it. I'm gonna draw 8 units of air, and I'm gonna take this out, and I'm gonna inject the air from here and pH and take it out, and I'm gonna draw 4 units of air, 4 units of air, and then inject it to my regular insulin. And inject back inside the air. And then now I'm gonna flip this up and draw my 4 units of regular insulin. And make sure you're precise about that. Okay, make sure no bubble. Okay. And now I'm gonna go ahead and do the same thing and then draw up an 8 and a total of 12. Let me show you so you can see it clearly. So it has to be a total of 12. I'm gonna go ahead and draw 10, 11, 12. Okay. So now I have a total of 12, and if I see any bubbles, I can just do this to take out any bubbles I see. Let me show you closely. Okay, and I have 12. Do I show you? Yeah, 12 units of insulin. And before I go ahead and administer this, I again make sure that I'm giving the right medication, the right dosage. That would be the last thing I'll check, giving it's the right dose, because the order is 4 units of regular and 8 units of the NPH, a total of 12. So this is a 12 units. So I verify and combine the dosage against the MAR again, and because I can't be walking to the patient if I'm not prepping this bedside on the bedside of the patient. I can't be walking to the room like this. So what I'm gonna do is just gonna put it I'm gonna pull this cup like this and put it up. Just scoop I'm gonna use the scoop method because my table is very kind of slippery, so it wasn't like going away, but I'm gonna do the scoop method and put it inside like this. And then label it, not to make any medication error. You can either label it if you're not making preparing it at the bedside, label it, and then you take it out. You take it to the patient with you, and then make sure you verify again with the patient before administering. And after we use this, as I said, if insulin is away from the patient side, we make sure we label it with the name and the dose, so we don't have any medication error. And after that, we make sure, and then the reason we cap this up, we put this, but the scoop method, we put this back is just for safety purpose, because there is a lot of needle stick injuries, so to prevent that, that's what we do. Make sure you label it with the name and the dose, and you take it to the patient side. After administering the medication, make sure you discard it at the right place where the syringe and sharp needles container. And then that's it. And then I'm gonna, let's say I administer it, I'm gonna discard this to the sharp and needles container. I'm gonna take off my my gloves, wash my hands, ask my patients if they're comfortable, if they need anything, and I'll let them know they will be getting their meal shortly. And I'll ask them if there is anything, any side effects, any adverse effects they may experience, to let us know. And then I'm gonna go wash my hands, undo privacy, and do my last right of medication administration, which is right documentation. I'm gonna go ahead and document my medication administration. And thank you so much.